Hello everyone, I'm Dr. Mitchell, a urologist and men's health expert. For more than 12 years, I've helped men not only improve their health but also rebuild their confidence, relationships, and sense of self. Today, we're diving into one of those topics that most men wonder about but rarely talk about out loud. It's personal, it's real, and yes, maybe a little awkward. But here, on this channel, nothing about men's health should ever be taboo. Because when we talk openly, we remove shame. And when we remove shame, we grow stronger, wiser, and more connected. So, let's address a question many men quietly Google late at night. Is it safe to swallow vaginal fluids during oral intimacy? What about the taste or smell? Is it normal? Is it healthy? These are important questions, ones that affect confidence, closeness, and even how comfortable intimacy feels. And surprisingly, most men don't actually know the science behind it. So today, I'll break it all down medically, biologically, and emotionally so you and your partner can share intimacy that feels safe, natural, and free of worry. Before we start, I'd love to know, where are you watching from today? Type your country or city down in the comments. I always enjoy seeing this incredible global community of men learning together. And if you're new here, make sure to like this video and subscribe to get more real, science-based advice about men's health, vitality, and intimacy every week. The first thing you should know: vaginal fluids are not dirty, toxic, or something to be ashamed of. In healthy women, these fluids are naturally designed to protect delicate tissues, balance bacteria, and make intimacy smoother and more enjoyable. It's the body's intelligent design at work. Yet, many men secretly worry, what if it's unsafe? What if something smells off? What if something's wrong with my partner? Here's the truth: variation is completely normal, safety is possible, and communication is the key that keeps everything healthy and connected. Once you understand what's happening biologically, the mystery fades and you realize the female body is simply doing what it's meant to do. After years of working with men from their 20s to their 70s, I've noticed a pattern. So let's walk through 5 common mistakes men make when it comes to vaginal fluids. Mistake number 5: thinking it's just moisture. That's a big misunderstanding. Vaginal lubrication isn't random, it's a biological masterpiece. The Bartholin's glands release natural lubrication to reduce friction. The Skene's glands near the urethra add additional fluid, sometimes even linked to female ejaculation. The cervix also produces mucus that helps protect and balance the vaginal environment. Together, they create comfort, safety, and pleasure. Ignoring this is like ignoring how perfectly your own body is designed. Mistake number 4: assuming taste or smell means something's wrong. Let's clear this up. Every woman's natural scent and taste are unique. Diet, hydration, stress, and hormones all play a role. Even something as simple as eating pineapple or berries can make fluids lighter and fresher, while garlic, alcohol, or coffee might create a stronger edge. During ovulation, fluids may increase and feel neutral. Around menstruation, they can have a mild metallic note. After menopause, they may become slightly more acidic or less abundant. None of this means there's a problem, it's just individuality. You should only be concerned if there's a sudden unpleasant change, for example, itching, irritation, or abnormal discharge. That usually means there's a simple infection or imbalance, and it's easily treatable. Mistake number 3: forgetting about health status. Here's a fact: vaginal fluids are mostly made up of water, enzymes, amino acids, and lactic acid, which helps protect against infections. However, just like semen or blood, they can carry sexually transmitted infections such as chlamydia, gonorrhea, herpes, or HIV. So no, it's not always safe. It depends on health and trust. That's why open conversations about testing and health aren't unromantic, they're essential. They show respect, maturity, and care for your partner. Mistake number 2: avoiding the testing talk. This is one of the hardest but most important parts. Many men are nervous to ask, "Have you been tested? Or should we go together?" I remember a patient in his 60s who came to me extremely anxious after being intimate with a new partner. He had bleeding gums and was terrified about HIV. The risk from oral intimacy is very low, but not zero. When he and his partner decided to get tested together, both turned out negative, and the process made them more open and closer than ever. Talking about safety doesn't ruin romance, it builds trust. Mistake number 1: reacting with shame instead of acceptance. This is the most damaging one. If something smells different or tastes stronger, some men joke, criticize, or pull away. But that reaction creates shame, and shame kills intimacy. A better approach? Kindness. Suggest showering together. Encourage good hydration. Make it something you handle as a team. Acceptance is far more attractive than judgment. When a woman feels safe and accepted, her trust grows and so does intimacy. Here's how to make sure intimacy is both safe and deeply rewarding. Talk openly. Normalize conversations about fluids, health, and comfort. Get tested together. Make it part of your routine once or twice a year. Maintain hygiene. Shower before intimacy. Stay hydrated. And eat balanced meals. Show compassion. Treat any changes as something to handle together. Celebrate connection. For many women, acceptance itself is deeply intimate. And yes, for healthy, infection-free couples, swallowing vaginal fluids is generally safe. Men, please remember this. You are never too old for intimacy. Desire doesn't have an age limit. Trust and connection only grow stronger when you nurture them. If you've ever felt embarrassed or unsure about this topic, let that go. Thousands of men wonder the same thing. You are not alone. When you approach intimacy with knowledge, respect, and compassion, you don't just protect your health, you strengthen your bond. So yes, for healthy couples, it's safe. And variation? Completely normal. But the real secret to fulfilling intimacy isn't chemistry, it's communication and care. If you found this video helpful, give it a like, subscribe, and share it with someone who might need it. Tell me in the comments where you're watching from. I love hearing from all of you. Remember this. Your health is your confidence. Your confidence is your connection. And passion when nurtured never fades. I'm Dr. Mitchell, and I'll see you in the next video.